I hope you all are able to hear my voice properly, and you'll just be able to see the screen. And whatever your doubts are, we'll clear that at the end of the session as told to you. So, this is what the topic is: heart disease. How do I know? And my introduction has already been given to you. Right. So now, why the focus on the heart? Now, all of us are very frequently we have gone through health checkups and everything, and we see that most of the health checkups and in fact all the health checkups that you go through are focused on the heart. Now, there's a reason why there is a major focus on the heart. That's because of the importance of the heart. The heart beats 80 times per minute. If you calculate that, it roughly comes to 4,800 times per hour, which is approximately 4.2 crore times in a year. So, if somebody is living for 80 years, then the heart has to beat 336 crore times. So, that is unimaginable work. So, what is important is there is no rest for the heart. Whether you're sleeping, you're working, but your heart cannot rest, it cannot sleep, not even for a minute. A heart stops for 30 seconds, and that is how our life stops. So before we understand as to what are the risk factors and what are the problems with the heart, we should know how the heart works. Now there are two parts in the heart, grossly speaking. One is the electrical part, and the second is the mechanical or the labor part. Now, this diagram shows you the electrical part of the heart. The yellow lines which you see in the heart is basically the electrical circuit. This is the other diagram. This green channels are the ones which are like the wirings which we have inside our house through which the electricity passes through. So it starts from the top chamber, the one which is marked as SA node on the left side upper corner. And from there, the impulse, that is the electrical activity, it starts and then it passes along these green channels all through the heart. This is the electrical system. Now, when the electrical system stimulates the heart, so basically it is all the muscle mass, and when because of this electrical activity, the muscle mass contracts, that leads to the blood being supplied to the whole body. Now, as in this diagram, you can see the heart is like in the center of the body, and from there it pumps blood to your brains, to your upper limbs, lower limbs, everywhere. So basically, the heart is responsible for your complete blood supply in the body. Now, other than the whole body, the heart also supplies itself. Now, these arteries which you see here, the major artery is the aorta, from which you can see two small arteries which are supplying the heart itself. So, the heart is supplying everybody, like all organs in the body, as well as itself. So, what happens if there is electrical problem? Now, there are two types of electrical problem that can happen. It can either become slow or it can become fast. Now, when it becomes slow, there is less blood flow. Obviously, because the electrical activity is slow, so blood flow decreases. When there is less blood to the brain, that is what leads to fainting, or like in Hindi, what we say behoshi, and technically we call it as syncope. When there is less blood supply to the body, that is what leads to dyspnea or breathlessness. And because of less blood supply, less oxygen is supplied, which leads to fatigue and tiredness. Now, when the electrical problem leads to a like increased heart rate, that is what we perceive as palpitations, or dharkan is what we say there. Now, if there is a mechanical problem, again the heart is not able to pump blood properly, because of which there is less blood which is pumped out. There is less blood supply to the body, which leads to again same fatigue as well as breathlessness. When there is less blood supply to the heart per se, that is what leads to chest pain, which is the most common symptom that we are aware of, what we call as angina. So, if we summarize this, then the earliest signs of heart disease that we have are angina, that is chest pain, dyspnea or breathlessness, fatigue or tiredness, fainting, or technically what we call as syncope, and palpitations. So, practically, if you don't have any of these symptoms, if you don't have any of these five symptoms, that is chest pain, breathlessness, fatigue, fainting, or palpitations, it is unlikely that you will have any heart disease. So 95% of patients who have cardiac illness, they present with one of these symptoms. So if you don't have this, then it is most likely that you don't have any heart disease. So next question is, why does this problem happen? Now, when it comes to electrical problem, the most common cause is age and genetic. So with age, the circuit that I had shown you, that is the electrical system inside the heart, there is deposition of calcium as well as other tissue onto that, and because of which there is a break in the continuity of that circuit. That is what leads to problem in the electrical activity, which happens with age. Now this happens in everybody. It is just that the degree to which it happens determines the symptoms which you can develop. So minor changes usually doesn't lead to any problem, but if there is a complete breakage of that circuit, that is what leads to slowing of the electrical activity, and that is what leads to syncope or fainting. Now, the other reason is genetic. There are some people who are born with inherent defect in that electrical circuit. Now, when it comes to mechanical problem, the most common cause for mechanical problem is heart attack. So that is usually because of less blood supply to the heart that leads to the damage of the heart muscle, and because of which the heart is not able to pump to its full capacity. The second common cause for that is infection, and again the third is genetic, which is always a possibility. Now, this is how the normal blood flows to the heart. Now, these are the arteries which are supplying the heart, what we call as coronary arteries. Now, if you see the normal artery, it shows that there is a smooth flow of blood inside this artery. But when you see the other artery on the right side, that is the blocked artery, what you see is that there is something which has been labeled as plaque there. Now, this plaque is essentially a deposition of cholesterol there. And because of this deposition of cholesterol, the path of the blood has been partially occluded. So, this is what we call as coronary artery disease, and this is what leads to chest pain or heart attacks. Now, this deposition of cholesterol can be of varying severity. Now, the depending on the severity, the blockages can be of different degrees. Like I have mentioned here, it can be 30% blockage, 50% blockage, 90%, 99%. Any degree of blockage can be there. Now, what is important to know is that some amount of blockage is inevitable in most of us because it is an age related process. So, as you grow, some amount of cholesterol deposition does take place. So, just like any other organ in the body, we have significant reserves in the body. It is just like we have two kidneys, even though we can survive with one. And there are most of the times in most of the organs, we have got significant reserves. Similarly, we have a good reserve in the blood supply of heart also. And usually, if the blockage is 50% or even up to 70%, it doesn't cause any problem to the person. Only when the blockage is more than 70% does it lead to a significant problem. So if somebody has told you or told any of your relatives that he has got a blockage of say 30% or 50%, that means nothing, because it is not going to cause any harm provided he takes further precautions and avoids all the factors which can lead to progression of this blockage. So as long as the blockage is less than 70%, we can safely manage it with medicines without having to resort to any surgery. Now, what are the risk factors for all these problems? So, when it comes to risk factors, we divide them into two groups. One is the modifiable group, the ones which are in your hand, about which you can do something. The second group is the non modifiable group, that is, they are fixed, about which you can do nothing, and they are part of the aging process. So, let's come to the non modifiable factors. Non modifiable factors, most important is age. Now, age, as your age increases, the chances of developing any cardiac problem, that is the coronary artery disease, increases, and there is nothing that can be done about this. Similarly, gender, the males are much more predisposed to develop any heart disease than females. That is an inherent risk factor about which nothing can be done. Similarly, if you have a family history, then you have a more likelihood, you are more likely to develop a cardiac problem than somebody who doesn't have a family history. Then comes ethnicity and race. Now, this is not as important in our population, but generally the whites, they are less predisposed to develop cardiac problems than the blacks. And if you see the Indian population, it will come somewhere in between. So, what are the modifiable risk factors? Now, these are the risk factors about which we can do something which can be modified, and if they are kept under control, the chance of developing any coronary artery disease they decrease significantly. Now, these modifiable risk factors are smoking, hypertension, diabetes, high cholesterol, high fat diet, stress, and sedentary lifestyle. So these are factors which are in our hand, and if we control them, then we decrease chances of developing any heart disease significantly. So I have basically to remember these points, put them in a simple way, and I generally say that you have to avoid 6S and promote FNG. Now the 6S are smoking, salt, that is which is related to hypertension, sugar, which is related to diabetes, stress, sedentary lifestyle, and saturated fats. Now these are the 6S which you have to avoid, and you have to increase your fruit and vegetable intake. Just by increasing your fruit and vegetable intake also, you significantly decrease any chances of developing heart disease. So you need to avoid the 6S and promote your F and G. Now smoking. Now the often the excuse that is given for smoking is this, that smoking helps you relax. Now when it comes to doctors, we say that this is the only way that smoking helps you relax. It There are reasons for this. You see, the smoking, when you smoke, you have 4,000 chemicals, 400 toxins, including hydrogen cyanide, arsenic, etc., which you are inhaling. Out of this, there are almost 43 possible carcinogens. Carcinogens mean the compounds which can possibly cause cancer in the body. It is highly addictive. If you start smoking and if you continue smoking for a month or two, it is going to be very difficult for you to leave smoking after that. And it affects almost all organs. It is not just the heart, it affects everything from the brain to your kidneys to your peripheral arteries, everything. And when it comes to smoking, there is no moderation that we can advise. The only thing we can do is quit smoking. Even in smoking problem, we have got two different types of smoke that are there. One is the mainstream smoke, which is inhaled directly by the person who smokes. The second is the second hand smoke, or the passive smokers. Now passive smoker, it becomes much more risky, for the simple reason that, one, you are not aware that you're actually smoking. Second, you don't know the amount of smoke that you have inhaled. And third, there is no filter that you use compared to the other smoke which is usually going through the filter. So passive smoking is much more dangerous. And when you smoke, you have to understand that you're not only harming yourself, you're harming your near and dear ones also. Now, physical activity. Now, when we mention physical activity, the most common thing that we get, I mean, the most common response is, where is the time? Now, it totally depends on us as to how we take out time and how we understand the importance of taking time out for physical activity. Now, why is physical activity important? It is important because it exercises your heart, it helps in controlling your blood pressure, it helps in controlling your diabetes, cholesterol, lung exercises, practically every organ in the body exercises when you are doing physical activity. In fact, the borderline cases of blood pressure as well as diabetes can just be controlled by adequate physical activity without having without having to take any medicines. So that is why the physical activity is so important. Now, of course, if you have developed diabetes or hypertension or any such problem like high cholesterol, regular medications are very important. Just having developed diabetes and blood pressure doesn't mean that we are on an irreversible stage. If you are able to control your sugar as well as blood pressure and cholesterol within the limits with proper medications, then the chances of developing any of the problems decrease significantly. So regular drugs prevents complications. So it is important that if you have any of these problems, you regularly visit your doctors and keep these parameters under control. Now we discussed about high salt being a problem. So how do we control our salt intake? Now there are various what do you say forms of salt which are available in the market. Kala namak, the samudri namak, all these things. But practically there is no difference among them. Now, the problematic, what do you say, the compound inside this salt is the sodium chloride. So, the more the amount of sodium in your diet, more are the chances of you developing hypertension. So, there are some low sodium salts which are available in the market. Now, these are the ones which are very commonly available: Safola Salt Plus, Tata Salt Light, Dr. Salt. Now, all of them, they have got to some extent some amount of potassium chloride. So generally, the amount is around 15% of the total. Now, potassium chloride, because there is less of sodium in that, I mean, partially you are replacing the sodium with potassium. That leads to decreased sodium intake. That helps in controlling your blood pressure. Now, the next question will be, why not take only potassium chloride instead of sodium chloride? Now, potassium is, potassium chloride leads to high blood potassium. Now, high blood potassium is again dangerous for the heart because it affects the electrical activity of the heart. That is why we cannot totally replace sodium chloride with potassium chloride. But small amount of potassium chloride, if taken, doesn't cause any harm. So before you start these medicines, it is very important to ask your doctor that you are going to start this, because there are some medicines which retain potassium in your body. So if you are on any of those medicines, then you have to either change those medicines or avoid taking this salt. So the only advice before you start taking this salt is, just ask your doctor if you are taking some medicines which affects the potassium metabolism in the body. Otherwise, they are very safe and are very commonly available and used also. Now, next comes low sugar. Now, we have a lot of artificial sweeteners like Splenda, sugar free, all these things. But there is a lot of, what do you say, falsehood which is there, that they can lead to increased chances of cancer or some other problem. But actually speaking, there is no adverse literature which is available to say that any of them lead to any of such problems. Now, they have been available in the market since more than 40 years now, and the long term data doesn't show that any of them lead to either cancer or any other problem which can be attributed to them. But at the same time, if you want to use them for weight loss, then it is probably not the right choice, because it has been mainly used in very small amounts by most of the people. What happens when you are using in very high amounts is something we don't know. So when we don't have data, so we cannot be sure that somebody who is taking 10 grams in a day is the same as somebody taking 50 grams in a day. So practically, if you don't have diabetes and if you are exercising well, then you don't really have to take this artificial sweeteners for your routine food. You can use sugar. We have been using sugars in billions of years. I mean, since human beings are there, and we know that if taken in normal amounts without having like very high intake, they don't really cause much of harm. It is just that when you take it in very large amounts, then that leads to diabetes, especially the ones with total empty calories, like our soft drinks and all, in which there is just sugar and nothing else. Saturated fat. Now, when it comes to fat intake, we have the dietary fat intake. There are two types that are there. One is the invisible fat. Invisible fat basically means that you are taking that fat without knowing that actually there is fat which is there inside. Now, the simple example is just like taking your chapati or rice, and we presume that there is no fat in that, but there is some inherent fat which is present in any of the cereals that you take. And the other one is the visible fat. Visible fat is the fat which we are directly seeing. That is the oil that we take, the vanaspati, ghee, butter, etc. So dietary fat basically includes invisible as well as the visible fat. Now, the problem is saturated fat. Right. So these are the three types of fat which actually are taken by you: the saturated fat, unsaturated fat, and the trans fat. Now, out of this, the most problematic is the trans fat. Saturated fat comes next, and unsaturated fat is the healthiest of the three. So, trans fat is the one which has got, which has been proven to cause increased problems in the heart. So that is the one which has to be totally avoided. Now, saturated fat again leads to increased blood cholesterol, which has been proven. But a direct correlation between saturated fat and cardiac illness, direct and definite correlation, is yet to come. But yes, because it leads to increase in blood cholesterol level, so it is advisable to avoid saturated fat also. Unsaturated fat is the one which is the safest of the three, but anything taken in very high amounts again becomes unhealthy. So, but if you have to take something out of the three, then it is preferably unsaturated fat. Now, often the question which is asked is, what happens if we take zero fat? Now, zero fat is a very unhealthy option because your body needs fat. It is an essential component of your diet. And if you keep zero fat, then it is very likely that you are going to develop deficient, what do you say, body parameters. So a daily intake for an adult of 15 to 20 grams of fat is must, because many organs in the body, they are critically dependent on the fat. For example, your brain is almost 90%, it is all fat. So unless you have adequate fat intake, which is required for the normal body activity, it is going to cause harm to you. So, as we discussed, the worst of this is the trans fat. Now, trans fat is the one which you get in your bakery foods, the cookies, fried fast food, cakes. So, practically all the ones which are, the food items which need long term storage, they are usually made with trans fat. So, we have to avoid those items, like especially the bakery products, because they are very rich in trans fat. Now, when it comes to saturated fat, it is mainly the ghee, butter that we see. Unsaturated fat is the one which we use commonly, that is the cooking oil. Now, when it comes to this also, now you have two different types of cooking oil. One is the refined and the non-refined. And within the cooking oil, you have monounsaturated fatty acids and polyunsaturated fatty acids. Then again, within the polyunsaturated fatty acids, you have got omega 6 and omega 3. So this becomes more and more confusing as you keep on dividing it more and more. To put it in simple terms, the more the omega 3 intake, the more the omega 3 content of your oil, the better it is. The importance of omega 6 and omega 3 ratio is, that is what is very important, that you should have a good ratio of omega 6 with omega 3. The best way to do is, if you ask me one oil which is the best, then I don't have an answer. That is why what is advisable is rotate your oils. So every 2 months you should change your oil, because every oil has got different amounts of omega 6 and omega 3. None of the oils is perfect, because some of them have got high omega 3, some of them have got high omega 6, some of them have got increased mufa, some others have got pufa. So they are not complete on their own. So the best way to do that is just rotate your oils every 2 months. Keep changing your oil. You can use sunflower oil, mustard oil, olive oil, anything, but keep changing them after every 2 months. Now, this is a table which actually shows the percentage of different things, that is, the saturated fat, the monounsaturated, and the linoleic and alpha linoleic are the linoleic basically is omega 6, and alpha linolenic is omega 3. Now, this is like all the oils are there in that, but if you see among these oils, then if you see the mustard oil, you see that mustard oil actually has got very less amount of saturated fat. It is only 8%. The monounsaturated is 70%, and then the omega 6 is 12, and omega 3 is 10. So this is like one of the good oils that you can use, because it has a very good ratio of omega 6 as well as omega 3. When I say very good, it doesn't mean that the omega 6 to omega 3 ratio should be very high. Now, sorry, I didn't clarify on that. When I say a good ratio, it basically means that it should not be less than 10. So you should have at least 10 is to 1, because of late the newer oils which we are getting, they have got very high amount of omega 6 compared to omega 3. Now, less omega 3 is not good at all. So any oil which gives you a ratio of less than 10 is actually good. On a ratio of omega 6 to omega 3 more than 10 is not very healthy. So if you see mustard oil, this has got a ratio of 1.2, which is actually very good, and monounsaturated at 70%. The other oil which is similarly very good is the olive oil. You see the saturated fat is 13, monounsaturated is 76, and the omega 6 to omega 3 ratio here is around 20. So if you compare all of them, then probably one of the best oils that you can use is the mustard oil. Right. Next comes alcohol. Now there is interesting controversy when it comes to alcohol. There are different versions as to whether you should take alcohol or you shouldn't take. Most of the people, they say that no, 2 drinks can be allowed per day. But when we say that 2 drinks can be allowed per day, this is definitely not what we mean. So the size of your drinks is very important, and not just the number. So what is important to understand is that uh, alcohol per se cannot be taken as a medication. It is not that if you start taking alcohol, then the chances of heart disease decrease. It may be beneficial. What the studies have shown is that it is definitely not harmful if it is taken in moderation. And whether it is actually going to have a reverse, I mean, effect on your heart disease, that is to prevent your heart disease, now that is something which is yet to be proven. It is also important to understand that it cannot be taken as an average. You cannot take it on a weekend to say that it has been, I mean, you take say 100 ml or 200 ml on a weekend and then divide it by 6. It is not that way. Per day, the maximum amount that is allowed is 60 ml per day, which can be taken as a safe amount. So doctors are annoying, but unfortunately, this is our profession, and we have to advise you against all the nice things which are available in life. Right now, treatment has become much simpler and better now. Now, when it comes to electrical problems, we have pacemakers now, which is like because of technology, it has evolved so much. There was a time when the pacemaker used to weigh almost 20 kilos. It had to be carried in a trolley. But as of now, the pacemakers, the smallest ones, they weigh only between 20 to 30 grams. All that you need is a small cut of around 1 inch, and then the pacemaker is put there, and as you can see in this diagram, that acts like a battery, and we have wires which are going inside your heart to supply the heart if there is a problem with the electrical activity. Similarly, the evolution of stents has revolutionized the whole cardiac treatment, because there was a time when for every small thing patients had to undergo bypass surgery. But now, with the evolution of stents, almost 70 to 80% of the patients can be managed without any bypass surgery. This is one of the major inventions which has helped people a lot. And basically, what it is essentially a metal scaffolding which is taken inside the body through a small hole, and a balloon is also introduced along with that, and we position it such a way that the metal scaffolding that remain inside the body while everything else comes out, and that keeps the artery patent. Bypass surgery is still available. The chances of complications have decreased significantly over the years because of increase in the technology as well as the expertise. So the difficult cases, or the cases where the stenting is not a viable option, they are still subjected to bypass surgery, and the risk has become much less than before. Now, what is but important, very important to understand, is 80 to 90% of cases can be managed with just medicines. It has to be a right decision by the doctor as well as the patient, which is important. Of course, we need some extra investigations, but that is probably worth it, because having, like, to put a stent inside, or say to undergo a bypass surgery, is more of a problem rather than having to undergo one or two extra investigations. Now technology has given us instruments as well as diagnostic modalities which can easily tell us which patient actually needs a stent or a bypass, and which patient can be managed by just medicines. When I say a right decision by the doctor as well as patient, that is an important point, because many a times it is a patient who sort of force or who compel or pressurize the doctor to do something about something, say a block of 60% or 70%, because they feel that no, I continuously have a psychological, what do you say, problem, because it is in my mind that I have a blockage of 60%, so you please clear that. Now that is actually not going to help, because this is a false notion that after stenting or bypass I am 100% secure. That's a wrong notion. It doesn't happen that once you have got a stent or a bypass surgery then you're secure. No, you have to understand that all of these things are artificial, and anything which is not natural is bound to have some failure rates. So even though the failure rates have improved significantly compared to what it was earlier, it can still not match what God has made. So as long as it is avoidable, it is better to avoid stenting or bypass surgery. Everything has got a scientific basis, so you just have to go by those scientific basis. Ask your doctor whether it is actually absolutely needed or not. And at the same time, there are people who are on the extreme side, on the other side, where we advise repeatedly that you have to get some surgery or bypass done, but they don't get it done. Now what you have to understand is, if it is needed, you can't avoid it, because if you could have avoided it, it wouldn't have been invented. There is no magic wand. All, it's a lot of WhatsApp circulations, Facebook circulations about some vague things, which some jadi booty treatment and all those which clears this thing. It doesn't happen, because even Bill Clinton had to undergo stenting, bypass surgery, even Manmohan Singh, everybody, practically all of them had to undergo. And if there was actually something which could have cured them, then they would have definitely opted for that. So no clinical studies this have shown anything which clears the blockages other than the stents or the bypass surgery. So if it is needed, absolutely there is no way to avoid it. But yes, if it is not needed, then there is I mean, it should be avoided as much as possible and should be managed with medicines. Now, this is another question which is frequently asked, whether stents or bypass surgery. So my answer to this is, now, whether it is stenting or bypass surgery, somebody who has been doing like thousands of these procedures, it's a very easy job for us to do a stenting or a bypass surgery. Now, what is difficult is when not to do. Now, that is what is important, and that is what decides how good the doctor is. It is very important to understand that when it is not needed, it shouldn't be done. In many cases, it happens that there is a varying opinion. It is very common that for a single case, two or three doctors may have different opinions. Decision is important in such cases, and that is why a team of doctors is what is important. Now, as per the present American guidelines, also, they advise that a person should be seen by a team of doctors when it comes to taking decision in these questionable cases, rather than by a single individual. Now, it is also important that all the like members in that team, all of them have to be senior consultants who have got independent decision taking facility. Now, based on this concept itself, we have got a heart care team at Apollo, where we always make sure that patients in which there is a doubt about stent or bypass surgery is seen by all three people, and then we take a combined decision. Now, this is our team in Apollo. So, to conclude, majority of heart disease is preventable. Now, early detection helps in averting tragedy. Contact your doctor in case of any symptoms. The earliest it is detected, the easily it can be managed. Remember to avoid the 6S and increase your fruit and vegetable intake. Now, prevention is better than cure. Right decision is very important for the doctor as well as the patient. Now, few of the factors which you should do right from today to avoid heart diseases. One, quit smoking, start walking, enjoy your life. You work to live and not the other way around. Modify your diet, and remember that it's never too late to start. This is my college, and this was our motto: dedication, sincerity, and passion. And I'm proud to be from a college which is renowned all over the world. Yes. Thank you.